My name is Anastasia. I'm from Denver, Colorado. My original plan before I got pregnant was to travel the world. I didn't want to go to college. I didn't want to, I just want to be free from school. Where do I start? I'm a young mom, so I just, really just stood home and I fell into depression and where do I, get my CNA? Who's going to support me, type of thing.
The type of students I usually work with are underserved youth, primarily 16 to 24-year-olds, really those students who don't have the same opportunities that other students in their school districts or communities might have. So my program is called the Health Careers Pre-Apprenticeship program, and it's really a career exploration program. A lot of my students come in, they're interested in healthcare, but the only jobs that they're really aware of are nurses, CNAs, and doctors, and healthcare is a vast field, vast industry to work in, and I really try to expose them to all the opportunities that are available.
But I didn't know what a BLS was and all the certificates that I got.
They come out with basic certifications like basic life support, first aid, HIPAA, ServSafe, and youth mental health first aid, along with some hands-on experiences and some soft skills training, although I hate to call them soft skills because they're really important in today's society, so we like to call them 21st century skills.
Here we learn, medical system. We learned about the anatomy. We've learned the cadaver lab we've been to. We learned just a lot of variety of different places in the healthcare.
Our mission can really be summed up in 3 different phrases, so connecting students to careers, professionals to communities, and communities to better health.
Finding consistency and a stable job and a schedule to fit my daughter's needs was really one of my big concerns, and I knew that in the healthcare, I could find that. And in AHIC, I learned so many different jobs. I could be a medical student, I could be CNA, I could be RN, LPN, doctor, even research. I know that there was so many different varieties, so many different schedules.
We want healthcare providers to look and be from the communities that they're serving. So that's our main goal, is to have those primary physicians and CNAs and nurses and all of those auxiliary occupations to look and feel like the communities that they serve.
After I finished AHIC, it was really easy because a lot of nursing homes or even hospitals, I didn't even know you could get jobs with your BLS, which is basic life support. Callie had told me about a job fair for Swedish, and I went to it, and they didn't have a position that I wanted to do, which was patient care technician. You had to have your CNA, but they were like, hey, you have your BLS? Yes, I do. Okay, well, we have this job we're trying to get finalized. It's monitoring patients behind the screen. Would you like to go shadow somebody? Yeah, of course. Took me back, shadowed what I would be doing, and I had a panel interview after that, and I got the job.
Anastasia was really successful because, one, she showed up every day. That's not an easy thing to do, especially with students with these circumstances. A lot of them have some circumstances that make it really hard for them to even attend class every day. So she was there every day. She always had a really positive attitude, and she had a really concrete goal and vision of where she wanted to be, and she's taking those steps to get there.
The thing that made me want to get into the medical field was having my daughter and realizing that I could become someone who could take care of her primarily.
It's a pay it forward aspects. It makes me feel really good that I know that I'm making an impact in someone's life and they have a sustainable future and a pathway that they know all the steps to get to where they want to be, and maybe that's their dream job at the end of the day, and we give them the foundation to get to that point.
It's a good program. It's such a great opportunity to learn what do you want to, if you don't know what you want to be in the healthcare field, this is a program to be at.
American Graduate Getting to Work is made possible by the Corporation for Public Broadcasting.